27th? I'm sorry, August 27th.
You're ahead of yourself.
I know, I'm looking for the good weather.
All right.
Yes, please call the roll.
All right. Rosano. Here. Simpson.
Here.
Cleary.
Here.
Epicoro.
Here.
Andrew Joyce is excused. Miller.
Present.
Fine.
Here.
Lucker.
Here.
And Pearlie.
Here.
You have a quorum.
Thank you. First order of business is to approve the minutes of the previous meeting. Did everybody have a chance to read them and go over them? And
Motion to approve.
Matt Miller, can I have a second?
Second.
Okay, Mickey? Now on to the agenda for this evening. I'm sorry. I'm sorry. All in favor?
Aye.
Motion carried.
All right. Item 2 is authorizing an agreement with Trinity Alliance of the Capital Region regarding the provision of Family and Neighborhood Resource Center services. Commissioner Manning is here this evening.
Thank you, committee members and chairwoman. So the COPS program, which is the Community Optional Preventive Service Program, they have been funding the Neighborhood Resource Center at Trinity since 2005. It's really key to families to get support that they need. You know, concrete services as well as clinical services to support the family, to avoid a child going into the juvenile justice system, going into a psychiatric hospital, and really being maintained safely in the community. If there is a need because of abuse or neglect for the child to be placed, they really work diligently to get that child and family reunited as quickly as possible.
Any questions? I have a motion. Second? All in favor?
Aye.
Opposed? Motion carried.
Item 3 is authorizing an agreement with the Research Foundation for the State University of New York regarding the New York State Supervision and Treatment Services for Juveniles program. Commissioner?
Thank you. Yes, the STS-JP plan, the evaluation is provided through SUNY Albany, and we have a researcher about 37% of her time, and really looking at the juveniles going into placement or getting involved in probation. So what she's been doing as of late is also working on our SPEAR, which is shifting power for equity and results. And Legislator Simpson was actually at our first meeting this past week, and really it's an opportunity to get the community involved, engage the community, and help them identify needs and how the county and they can work together.
Any questions? I have a motion? Matt? Vicky, second? Okay. Motion carried. All in favor?
Aye. Take away our vote, do you?
Thank you.
Hey, thank you, Commissioner.
Item 4 is authorizing an agreement with the Altamont program regarding emergency and transitional shelter services for homeless single women. Commissioner McClave is here this evening.
Good evening.
Hello, Commissioner.
Thank you.
I have a lot of these tonight, so. This is for the Thornton Avenue Shelter. It's a 10-bed women's shelter run by the Altamont program for $314,000. Mostly safety net folks in there. So it's a 61% county share. And it has 6 rooms with 2 full baths, so it's more small and intimate. 40 clients were served through the facility in 2023.
I'm sorry, can you tell me what that address was again?
It is 50 Thornton.
Thank you. Does anybody have any questions for the Commissioner? Can I have a motion? Patty? Second? All those in favor?
Aye.
Motion carries.
Item 5 is authorizing an agreement with Interfaith Partnership for the Homeless regarding emergency and transitional shelter services.
Yes, this is for IPH's Sheridan Avenue facility that they've had for decades, I believe. It is a 30-bed shelter, 15 beds for men, 15 beds for women. They serve 3 meals a day, provide case management and other support services, referrals, and linkages to services. They served 181 unduplicated individuals in 2023. And this is, again, a lot of safety net folks, so it's 65% county share.
Any Pat?
Commissioner, I'm sorry, I think did you say 181?
Yeah, unduplicated
Yeah.
individuals last year, yeah.
Okay. Thank you.
Just with all these that you have coming up, are these all continuations or any of these new programs? As far as you know?
There's one new program, but it's not a shelter.
Okay, gotcha. Just as a shelter.
All the shelters are continuation.
Thank you.
Yeah.
Can I have a motion?
Motion.
Second? All those in favor?
Aye.
Oh, motion carries. Thank you.
Item 6 is authorizing an agreement with the Altamont program regarding emergency and transitional shelter services.
Yes, this is to renew a contract with Altamont Program to run the Skylar Inn, which is a 60-unit family shelter. And they provide, again, 3 meals a day, case management, support services, recreation, after-school assistance with homework, and other kind of wraparound services. They serve, this is more TANF families, but also some safety net families. So it's a 27% county share and a $1.9 million proposal. And they served from 7/1/22 to 6/30/23, 425 homeless families.
Does anyone have any questions? Can I have a motion? Ms. Lockhart? Second? Mr. Miller? All those in favor?
Aye.
Motion carries.
Item 7 is authorizing an agreement with Interfaith Partnership for the Homeless regarding emergency shelter services at the Sister Mavis Jewel Medical Respite for the Homeless.
This is to request authorization to pay a per diem for up to 10 beds and up to $252,000 for folks who need to actually stay in the shelter for 24 hours because of a medical problem or an injury. So they need more recovery time. They can't leave the facility during the day. And they provide linkage to medical appointments, some transportation, 3 meals, of course, and help them plan for their aftercare. And we served, through this facility, 37 individuals were served in 2023.
Does anyone have any question? Commissioner, do the referrals for this facility come from hospitals, or is it the worker who has been involved with them and realizes they can't go back to their previous living situation?
Some of them do come from the hospitals. We also make referrals for someone who might come into our office who appears to have some added problems, and also it's wheelchair accessible. So, but yes, some of the hospitals, if it's a hospital from Rensselaer County though, they will pay for it themselves. So that's why we have up to 10 beds. It's a per diem.
Thank you. Can I have a motion? Mr. Miller?
Second.
Ms. Lockhart? Motion carries? No?
All those in favor?
All those in favor? Motion carries.
It's in your head now.
Item 8 is authorizing an agreement with Interfaith Partnership for the Homeless regarding emergency and transitional shelter services at Mercy House.
Yes, this is a contract, again, with IPH for a 20-bed facility serving 6 females and 14 males. What formerly was Mercy House, they're still calling it Mercy House, on Joseph's Terrace in Albany, for $686,000. And they provide all the other supportive services and meals as well through this contract.
Any questions? Can I have a motion? Ms. Lockhart, second. Matt? All those in favor? Aye. Motion carries.
Item 9 is authorizing an agreement with Interfaith Partnership for the Homeless regarding emergency and transitional shelter services at the South Ferry Shelter.
So this is also a 20-bed, it's actually in the same facility as the respite is, but we contract for 20 beds for this contract, both males and females, because they have separate rooms, so they can mix it up according to what our needs are. And they provide 3 meals a day, and case management wraparound services. They served 87 clients last year, and again, this is a $686,000 contract, same as the Mercy House.
Are there any questions? Can I have a motion? Ms. Lever? All those in favor? Motion carries.
Item 10 is authorizing an agreement with Equinox, Inc. regarding non-residential domestic violence services.
Yes, we're asking to contract with Equinox. Again, this is pass-through funding, 100% federal funding that OCFS designates Equinox to receive. So through this funding, they provide their core services of a hotline, in-person counseling, referral, placement services for people who are victims of domestic violence. And then they have a second component, which is smaller, $36,000 of this fee for intensive case management for people who are receiving TANF services. And they took 2,956 calls, and they did 738 placements last year.
Are there any questions? Can I have a motion? Second? All those in favor? Motion carries.
Item 11 is authorizing an agreement with St. Catherine's Center for Children, Marillac residents regarding the provision of family shelter services.
This is also a family shelter. They have 24 units for families. This is a state-designated Tier 2 shelter, which is a more intensive case management and working with people over a longer period of time. And again, wraparound services, all the meals, laundry services, et cetera. And this is a state-established rate of $213 per family. And it's primarily TANF, but there are some safety net families that do reside there. So there is a small county, not small, but a county share, 24%. And last year, they served 76 families.
Are there any questions? Can I have a motion? Second? Ms. Lockhart? Motion carries? No. No? All in favor?
Aye.
Motion carries.
There you go. Item 12 is authorizing an agreement with the New York State Office of Temporary and Disability Assistance regarding grant funding and amending the 2024 Department of Social Services budget.
We're requesting authorization to accept a $496,000 appropriation from OTDA to establish a new family-centered case management program. It's 100% federal funding to work with TANF-eligible families, and these are families in our homeless shelters and families who have difficulty staying in stable housing, who may have repeated evictions, and problems in finding and staying in housing. We propose to create four positions, caseworker positions, to do intensive work with these families. One of them will be either a CASAC or have substance abuse experience to help people address those problems that they may have that may be a barrier to staying in permanent housing, and help them through their treatment program and get into recovery. Another caseworker will be doing intensive, even in-home services to help identify what the family dynamics might be and what the family problems might be that create evictions for them, landlord-tenant relationships, paying your bills, children, relationships with children, with the school system, et cetera, et cetera. So this is a unique opportunity for us to do something a little different than our eligibility work, but to pair it with our eligibility work to get people to achieve more independence. And then we also propose a couple caseworkers to work with those people that are identified as having a permanent disability, and that is their barrier to work and to achieving employment. And we're going to work with them intensely to get them to doctor's appointments, to get the documentation they may need to document their disability, and have them apply for Social Security disability so they can get on SSI or SSD, and have a more stable stream of income for themselves and their families.
Does anybody have any questions?
No one on the committee does.
Go ahead.
Commissioner, could you help me recall, TANF is for people who are they at the end of their benefit level, or then there's a supplemental program where at 100% of county costs we keep them on? Could you explain how this program interrelates with that?
Yeah, this is the TANF, which is Temporary Assistance to Needy Families, which is a federal program.
It's federal.
And we follow all the federal, it's 100% federally reimbursed. Their cash grant is federal funding. Our staff is paid for it through federal funding. And they have 60 months to be on the program, on the TANF program. And they have to achieve certain milestones and all of that. And, work with them to get off the program by the 60 months. There are some people that just can't do that and haven't done that. They then transition to Safety Net. So then it's Safety Net Family Assistance, and that is only a New York State program. And it's 71% county share on that. So you'll see some of those in our shelters and some of those on our Safety Net enrollment. And that they're extended beyond their 60-month period. They've used that up, basically.
So this program is just for the TANF, it's not for the safety net?
It's to prevent people from getting onto Safety Net.
Okay,
So they
that's
won't.
good.
So they'll
That's
find
good.
more permanency, either employment or Social Security or some other way of supporting themselves.
Ms. Lockhart?
Commissioner, is Safety Net, though, does all populations, in other words, not just families? And
Right.
Not single?
Right, you can be
Everybody.
single.
Okay.
If you're single, you would get Safety Net
Because there's a
benefits.
program for just like single people too, like I can't, it used to be.
Pardon me?
Just single people, there's a,
Will Safety Net, if they are eligible, otherwise eligible, they come in and apply, it would be Safety Net.
okay, all right.
Because you're not eligible for TANF if you're a single.
That's what I was thinking, right.
Mr. Decora?
Yes, thank you. Is this federal program, is this a new program? And if not, it's a new program?
Yes, it's
Okay.
brand new, yep. And this is New York State OTDA deciding that they wanted to use some TANF money to do this. So this is their initiative, and they got approval from the federal government to do this initiative.
Do you know when the timeline is to start it?
It's due August 30th. Our proposal is due to OTDA.
Okay.
So as soon as they approve it, we can start.
Thank you.
Go ahead, Mr. Pearl.
Commissioner, how many months of eligibility are allowed under the Safety Net program?
Indeterminate, as long as you're performing the responsibilities, which is seeking job placement, getting job training, getting into substance abuse treatment, addressing your mental health issues. We work with people to make sure that they're in compliance. They'll go off, if they don't comply, they don't respond, they'll go off Safety Net, and they have to wait a certain period. They can come back and apply if they're willing to enter our job training program. And sometimes they get employment, and then it doesn't work out. So, but they're worked with. They're not, the singles are, and families too, but there's a lot of rules around if you have a baby under 1, and there's all kinds of rules around what you do with folks if they have a family. But the singles, yes, there's all kinds of rules around what they're supposed to be doing.
Question, how many families currently, or people, I should say, are you working with under Safety Net?
I'll get you that information. I don't know off the top of my head what the family and single breakdown is, and I think it's about 1,400 total, but let me
Just
find out.
about, yeah, that's a ballpark figure,
Yeah.
that's good.
And Commissioner, when you get that figure, could you also add an analysis of what percentage of the families sort of graduate successfully out of that, and what?
The turnover, I'll have to see what I can get on that.
Do you track that?
We don't, it's all state tracked, so we would have to find out if the state could tell us if this individual was getting services potentially in another county. We're not going to know that. You know what I mean? So they could have been on Safety Net in Schenectady County, and we would not know how many months they were on, you know. So that kind of information is not really
But the
available
state
to us.
would, right?
They
Potentially.
They probably would, but they don't.
This program being new, is it going to be your staff who's going to be moving over to take care of?
Oh, we're hiring additional staff.
Okay, you're,
Yes,
okay.
we'd be hiring a program manager and 4 additional caseworkers.
If the grant doesn't become available next year, will the program be dissolved, or will it?
That's always the question with grants, but we hope that if it's successful, we would be able to fold it into some of our other programs. Of course, the state has said that this is a permanent project for them, but yes, every year is probably going to be looked at.
Will the salary for these people involved in this be different than the salary for our caseworkers?
Yeah, no, they will be a caseworker, union member. They will be in the line according to our union contract.
Okay. Are there any other questions? Can I have a motion? Second? All in favor? Aye. Motion carries.
Thank you.
Can I have a motion to adjourn? Everybody's hands shoot up. Thank you. I'll get
Favor? Do you want to adjourn? All in favor?
No, you don't.
Oh, you don't
No,
get that one?
no one ever does. We'll just assume you all want to.
Assume we do.